Did you know that some of the best paid physicians in the U.S. live in South Dakota? Today we're going to discuss why the highest earning physicians in the country live in states with the least residency training programs. Hey folks, welcome to the Dr. Deals podcast, where we talk about healthcare business transactions. I'm Nick Newsat from HealthContract.com. South Dakota's physicians are making national news. The Washington Post has recently published a new study from the National Bureau of Economic Research that found that the best paid docs in America actually live in South Dakota, North Dakota, Alaska, and Wyoming. There are a couple different factors at play here, but I can confirm the author's thesis. A lack of physician residency training programs in certain states is a major factor driving up physician compensation. Wyoming, Alaska, and the Dakotas make up 4 of the 6 U.S. states with the least physician residents in training. Residency training programs are major recruiting sources for physicians. Not having residents makes physician recruitment much more expensive. During 2020, I published a 9-year study of the relocation patterns of over 270,000 physicians. The study found that about 9 out of 10 physicians initially stay in the same market where they completed their residency or fellowship training. Most of these docs start practicing in the exact same zip code or an adjacent zip code to where they completed their residency training. It turns out that physician residents are human beings. They get married, they buy houses, and they have kids. Once they put down roots, they tend to stay put. Of the few physicians who do move, less than 20% move to rural communities. Recruiters I've talked to say they actively seek to identify physicians who grew up in rural communities to try to recruit them to move back to their hometowns. Recruiters know from experience that the chances of convincing anyone else to move are quite low. The only way to overcome this resistance is to offer much higher compensation packages. Of course, the confounding factor here is reimbursement. Indiana has similar resident ratios to North and South Dakota, but physician compensation tends to be somewhat lower in Indiana. And that's because commercial reimbursement rates are lower in Indiana. When compared to Alaska, Wyoming, and the Dakotas, Indiana has a higher concentration of commercial managed care enrollees in one very large and dominant insurance company. The insurance carrier Elevance holds 75% to 90% of commercial PPO market share in most major Indiana markets. This high managed care concentration in one carrier drives down reimbursement rates and physician compensation. Do you need physician compensation data for specific local markets? I'm Nick Newsat from HealthContract.com. Give me a call to demo Datarise's 2023 provider compensation data. And let's do some doctor deals.